All right. Well, that's good fun. Today's COVID report is not. Today, we are reporting our second highest total that we have had since March the 6th at 1,018. That's 1018 new positive cases of COVID-19. 157 of those are kids under 18 years old. What that means is that we are on pace to have even more cases than last week, where we set a record number of cases. It brings our total number of cases we've had in the Commonwealth to 67,856. Now, our test positivity is at 4.24%, still below 5%. That's a positive thing. We have 589 Kentuckians currently in the hospital due to COVID-19, 129 in the ICU, 81 currently on a ventilator. Please pray for those individuals. New cases by county: Jefferson 226, Fayette 143, Laurel County 58 cases, Warren 29, Barron 28, Christian 26, Madison 26, Hardin 22, Callaway 19, Boyd 18, Rowan 16, Kenton 15, Henderson and Scott 14, Boone and Franklin 13, Carter, Union, and Whitley 11, Davis 10, and all the others you can find on the website, as well as the breakdown of racial and ethnic data by both cases and deaths. Today, sadly, we are reporting a loss of 8 additional Kentuckians due to COVID-19, or that COVID-19 was a contributing factor to their deaths. They include a 68-year-old man from Hickman, a 71-year-old woman from Henderson, a 77-year-old man from Floyd, an 86-year-old man from Bullitt, an 86-year-old woman from Kenton, an 85-year-old woman from Floyd, an 87-year-old woman from Kenton, and a 93-year-old woman from Bell. Let's remember and think about those families. Let's make sure we turn on our green lights, and let's also know that when we have 1,018 cases, it means we're going to lose more people moving forward. 1,018 cases is far too many. It does mean we're doing a lot of tests, and that's important, because we got to find those positives. We got to make sure that we can either quarantine them or get them the help they may need in the hospital. By finding those positive cases, it helps make sure that we can get them better. But 1,018 cases is going the wrong direction. So we need you to wear a facial covering. 1,018 cases ought to be a wake-up call if last week's 5,000, almost 5,000 cases wasn't. We can't let this thing get out of control again because maybe we're tired. We know the steps that it takes, and I think tomorrow we'll be back again with our revised top 10 rules to defeat COVID-19, because we probably need to talk about them more and again. But this mask, we really need you to wear it. We really need you to wear it. Long-term care facilities: since yesterday, 38 new residents, 23 new staff, 3 new deaths attributable to this population, 1 new facility. K through 12, again, this is our audited version. You're going to see the dashboard, which will have more up-to-date numbers, more immediate numbers. Again, remember, our dashboard is what's reported by schools for the day before. It hasn't gone through the vetting of the local health department and through us, but it's a way to have some immediate idea of what we may be seeing in your school or your community. And this is after it's gone through our process, which can lag 4 or 5 days. 15 new students, 14 new faculty or staff, 12 new schools with at least 1 positive case. This is just since yesterday on colleges and universities. 303 additional students, 2 additional faculty or staff, 3 new colleges or universities that are included. I know I said yesterday that I believed we were at the start of a new escalation. We're certainly seeing that in today's numbers. And that means we got to work harder. You know, this is a war, and we've won many battles. We can't walk away from the battlefield. We can't stop doing what it takes, and I really need your help. The fall, and I think Dr. Stack, who's back with us today after getting a week off, which I know was needed, will tell you that right now, moving into the fall, has the potential to be the most dangerous time we have seen in Kentucky. And it doesn't have to be, because we know that there is a vaccine in our future. We just have to get to the point where we can prove that it's effective and deploy it to enough people. So are we willing to do what it takes to protect one another until that point in time? I think that answer is yes, but we got to prove it.